Hello, my name is Dr. Todd, and I'm with West Valley Chiropractic. With another season of hockey beginning, I'm often asked a lot of questions at the rink in regards to concussions. So we've decided to put together a series of brief, concise videos outlining some of the more frequently asked questions. Today's video is about how do I recognize a suspected concussion? And if a concussion is suspected, what do I do about it? Well, first and foremost, if you suspect an athlete or your child does have a concussion, the most important thing to do is sit them out of play. The little mnemonic is, when in doubt, sit them out. Now, nothing will replace a proper assessment done by your medical doctor, your chiropractic doctor, or someone who's specifically trained in concussion assessment and management. Now, you're on the bench, you're up in the stands, your child is smashed into the boards and they appear to be hurt. How do I recognize a suspected concussion? There's a lot of resources available, whether you go on the internet, you download an app, but as most of you know, the internet in Totem 1 and the internet in Timbuktu, Alberta is pretty much non-existent. So what we've done is we've put together a little concussion pocket guide that's available for all the athletes. These are available at the hockey head office. We're going to try and get them to all the coaches and managers. But basically, take this little piece of paper, toss it in the bottom of your child's hockey bag, and if you need it, you can reference it instantly. Okay, back to the bench. The child has just come off the ice, they're hurt. Give them a couple minutes to settle down, start to feel a little bit better, gather their thoughts. Because the reality is, not all hits are going to result in a concussion. But most importantly, don't leave the child alone. Monitor and assess them. Now, when we're looking for a suspected concussion, some of the more common symptoms or signs and symptoms are going to be things such as a headache, dizziness, confusion, a bit of a vacant stare, not sure where they're at, what's going on. If you notice any of those symptoms, you must remove the child from play, have them properly assessed by a professional, and follow the CMHA concussion protocol. Now, something that can't be missed are the red flag signs and symptoms. These are very, very, very important. They can't be missed. If your child or the athlete has any of these symptoms, it's imperative that they get assessed at an urgent care or an emergency room immediately. Some of these symptoms include vomiting, loss of consciousness, seizures, convulsions, a deteriorating conscious state, restlessness, agitation, a combativeness state, double vision, a severe or worsening headache, neck pain, or burning, numbness, tingling into the arms or the hands. If they have these signs and symptoms, please take them to urgent care or an emergency room facility immediately. Okay, I happen to be at the rink most of the winter with coaching, with our kids in hockey. So if you see me at the rink, you have a question, stop me, just ask. The other things you can do is you can email the clinic, you can post comments below, or you know what, even call the office. Sometimes these questions need to be addressed one-on-one with me, so please try and get a hold of me in any way that you can. If you found this information helpful, please share it. And our next video is going to be on the importance of baseline testing.